panel discussion where we talk about some very important segments, being how organizations today are becoming the catalyst of change, uniting technology, medicine, and most of all, humanity when it comes in the healthcare sector. May I request all of you to please put your hands together as we bring to you our esteemed panelists, and moderating this very interesting panel discussion will be Mr. Siddhartha Bhattacharya, Secretary General, Healthcare Federation of India. We are honored and privileged to have him join us. Joining us on stage will be our Power Pack panelists. Please welcome Kiran Anandampillai, Advisor, National Health Authority. What a pleasure to have you here with us, sir. Let's hear a round of applause as we are now joined by Dr. D.S. Rana, Padma Shri Awardee Chairman, Sir Ganga Hospital. It is an honor to have him here with us. Please put your hands together for Dr. Harsh Mahajan, MD, Padma Shri Awardee, Founder and Chairman, Mahajan Imaging. Thank you so very much for your presence, sir. May I present to you Mr. Anand K, Managing Director and Chief Executive Officer, Agilus Diagnostics. Let's hear a round of applause. I welcome Mr. Chaitanya, Sarawate, President and CEO, GE Healthcare South Asia, Managing Director, Wipro GE Healthcare. Please do put your hands together as we welcome Mr. Sanjay, Vyas, Global SBU Head, Clinical Logistics and Global Safety Services and Managing Director, India, Parexel. Please also put your hands together and welcome Dr. Santosh, Shetty, CEO, Kokilaben, Dhirubhai, Ambani Hospital right here. I'd like to request you all to please take a seat as per the images on the backdrop so that it's easy for my audience to connect with you all while we have the discussion on.
Does this mic work?
I think it works.
Everyone wants to check their mics? Check.
Check.
Okay, good. So thank you for that introduction. The topic of the conversation today is really very interesting one. And the broad theme is convergence. As healthcare is evolving, these are the organizations on the dais today. They're luminaries cutting across different functions, verticals, different facets of healthcare. But each of them represent, and we're going to deliberate here, how the different organizations are becoming catalysts of change towards convergence and uniting technology, medicine, and most importantly, the humanity in healthcare, which is the patient side of the interface. The introductions have been already made, so I am going straight into the context setting. I think we have about close to 40 minutes for this conversation. Very quickly, we are at the cusp of real exciting possibilities in the years ahead in healthcare. We have been hearing a lot about healthcare since COVID. Digital intelligence, automation, themes like artificial intelligence is unifying this entire healthcare, fusing different parts of the healthcare systems together. The clinical side, financial side, supply chain side, education, governance, provisioning or delivery of care is reaching fast a point of convergence, with the patient being at the focal point of this unified supply chain. Growing evidence from India and globally shows that building an integrated healthcare system is the only way for us to wave off some of the massive challenges facing ahead, like, for example, the NCD burden. It's estimated it's a $6 trillion burden on the economy in India in the next 10 to 15 years, a huge burden ahead. In one of the surveys that we had done, there are significant, as NATHEALTH Bain, this is the data point I'm quoting on the NCD burden. Digital technologies are going to play a major force in the roadmap ahead. But again, the technologies alone is not the solution. The growing clinical evidences, innovations in the clinical front, and ultimately keeping the patient really at the front and center of the healthcare systems are going to be of enormous importance. We have with us a panel which I would like to start by requesting Mr. Anand K from Agilus Diagnostics, Anand. The ABDM stack, I think you have been one of the early adopters. What are the key insights that you would like to share with the audience in the way the possibilities that this Ayushman Bharat Digital Health Mission unfolds for the broad ecosystem? Would love to hear from you, please.
Thank you, Siddhartha, and good evening to everyone. So, Agilus Diagnostics was one of the early adopters of ABDM, and we were the first lab to be fully integrated with ABDM across all the 3 milestones. This process started about 2 years back, and in these 2 years, we have got about 250 of our labs integrated as a healthcare provider in the ABDM platform, and also we are one of the early labs. In fact, one of the first institutions to have more than 100 integrations in a day, as far as ABDM is concerned. But there are challenges. So when we talk about ABDM, so there is, what exactly happens as a process, and also how does it benefit the patient and the healthcare ecosystem. So that's what we need to look at. And the idea was that we will create a platform where there will be interoperability, so between various healthcare providers, and there will be a chance for accessing the data and providing a longitudinal kind of analysis, trend analysis for the patient, as well as there will be data availability across all platforms. But the challenges as we face are that the patients are reluctant to share the information. One is they need to do an Aadhaar enabled OTP process to get into this, and to convince them to do that is slightly difficult. One is because as a lab we are not on the real front end in terms of healthcare. So at a hospital level, maybe it could have been a little bit more easier, but at the lab level, it's a little bit more tough. But what we found was that the concerns of privacy was always there. So in terms of where the data will go, how will they be secure when they give access to multiple people? Even though it's an OTP enabled process, and at every point of access there is a consent which can be taken from the patient. But still, there are apprehensions, and I think the government and the various processes that get involved in this need to make sure that these concerns are addressed. We also saw that for the CGHS patients, they had made it mandatory that ABA ID has to be included in the whole process. But off late today, I think there was a news again that that has been no longer mandatory. So they want to further look at things. I think it's the interoperability issues and the data security issues that needs to be addressed, and some standards in terms of interoperability, in terms of FHIR standards or such things need to be brought about to bring in the best practices that are followed across the world, so that we are able to make more progress. But we are definitely moving ahead, and there are new patients who are getting added into the system, and I'm sure this will lead to a lot of change going forward. Thank you.
Thank you, Anand. It's very important that almost the entry point of a patient into the healthcare starts with the diagnostics, the preventive health side of it. So I'm moving from a diagnostic or a pathology, some to a radiology or an imaging side of the same sector. Dr. Mahajan, in terms of deep data analytics, deriving, digitizing data is one part of it. But what are the possibilities around AI, deep data, big data, predictable analytics, and what is the power ahead in terms of better pathways for patients and better pathways for experience of the patients? Over to you, sir.
Thank you very much, Siddhartha. Good evening, everyone. The possibilities of using data are immense. However, what we find, and this is not only in India, but across the globe, we like to say 1.4 billion Indians, so many hospitals, such a lot of data. But when you actually start looking for data, there's very little data. It is all unstructured, it is in different forms. Even within one institution, one hospital, departments don't talk to each other. Everyone is on their own. So that is one problem. However, I feel that India, being in its infancy as far as digitization and digital data goes, maybe we have an opportunity to leapfrog, just as we did because we didn't have landlines and we made it all mobile. Similarly, I sincerely feel that we have that opportunity. Second, the government having taken the lead. It's very surprising that with ABDM, the government is bringing out the structure that it wants. It's bringing out enabling possibilities. So, it is trying to bring one structure for the entire country, right from a large hospital all the way down to a small clinic. That actually is the vision. How long it'll take to achieve that, it's not going to happen in a year or two. It may take a decade. But if we start on that journey and everyone is on that same pathway, and from that large highway, little roads are taking off, I think it is possible. However, again, what is in it for the provider? Why should he do it? There's a patient coming to a clinic, the job gets done. Why? Why should he invest? Does he even have the knowledge or the wherewithal to be able to do it? Where does he find the money to put that infrastructure in place? That's where I think somewhere along the line, incentivizing and hand-holding will need to be done. So it'll have to be, something which the government and the private sector and the public sector will have to do together. Coming to artificial intelligence, and that is an area we at Mahajan Imaging and Labs have been working for the last 8 years, ever since DL, deep learning, came into being. And here again, centers like ours, hospitals, the IITs, small 1, 2, 3, youngsters getting together with a startup, India is doing a lot. In fact, after IT, if there is anything, and this is a number I heard yesterday, startups after IT, it's healthcare, where there are maximum number of startups in this country. And here again, there is a lot of incentivization that is done by the government as well as private incubators that have come in place. We, for one, have been working in the field of radiology and imaging. We have developed algorithms. And now what we developed, actually over the years, we saw that globally, thousands of algorithms being developed for different, say, a chest X-ray or a brain CT, brain MRI, and so on and so forth, but nothing being used. So we decided in 2018 to become the middle layer, the taking AI from the bench to the clinic, as we called it. And I'm glad to say, one, that the first paper in the Lancet on artificial intelligence came out of India. Our group and Cure.ai, another very, probably the best, AI startup in the world today. And our platform, which, we've been developing and improving over the last 6 years, is the first AI platform in healthcare to get US FDA approval about 2 months ago. So here again, if somehow an ecosystem can be created which can bring these diverse small entities together, I think India has the possibility of becoming not only the hospital of the world, but also the healthcare tech provider for the world, especially in the field of artificial intelligence, because there's so much talent. There are so many patients. There are so many good doctors. Every third doctor in the world is an Indian. So the possibilities are immense, but somehow, there has to be some glue which brings it together. The government is trying in its own way. Private institutions are trying, and I'm sure there's plenty that can be done. Thank you.
Thank you. So we heard from two of the real experts on the technology side here. Let's shift a little bit of gear and hear on the clinical side of things. So I'm going to turn a little bit to Dr. Rana, to you. One of the things that India consistently provides are great clinical outcomes at great values, which draws people from all around the world, right? I mean, when India does it at scale, there are very few countries which beats it. What do you think are some of the core underpinnings around which these great clinical outcomes in many areas that we see in India? And what do you see in the next 5 to 10 years with what we just heard, how it is going to exponentially grow or expand? Thank you. Over to you, sir.
Thank you, Siddhartha. I think we have got very good infrastructure of training for doctors and dedication of doctors are known all over the world, actually, not only in India. And the whole outcome of the main outcome, I say, of any patient treatment depends on doctors and then supporting staff. Though our nursing care is also very good. All what we are lacking right now in the country is structured training for paramedics, excluding nurses. We don't have good training for OT technician or other technical staff. So somehow tertiary care hospital, they have got it, but most of the centers do not have it. So the core point is that you require manpower. And over a period of time, like over the last decade or so, there is a mushrooming of, say, best health cases. I'm not talking about best health care, and I don't know why in hospital, not only in healthcare sector, not only innovative idea, but a lot of good hospitals are coming now. And the service, and they're providing services, tertiary care services in specialties. Whatever is available outside the country, that is available today in the country. So we have, and as far as technology is concerned, there is no dearth of technology now. Any technology is not confined to any country of origin, it can go anywhere. So all technology is also available. You require money to purchase technology, that is enough money there in the health sector. So once you have got well-equipped hospitals and good doctors and good technical staff, the outcome will be there, And of course, your social media also playing a lot of role in that, And you people are also playing a lot of role in doing this, encouraging the people. So overall, there is a good scene for the hospital in the near time also come. And over the last 2 decades, I see that hospital has, apart from technology, our country has seen a very, that it's not question of providing treatment only, but say in private sectors, hospitals are giving equal attention on hospitality sector also. People today, when they are paying, and they are paying in the private sector, they will not come only for doctors, they want that good diagnosis also there. So that sort of thing also being provided. I want to stress here that apart from providing quality health care at affordable prices to all sections of society, it is really very important for every hospital, tertiary care hospital especially, to have equal commitment in the field of medical education and research. And we are very proud of our hospital that we pay a lot of attention to medical education. Our hospital is one of the leading role model of the training for postgraduates. And even in private sector, say non-government sector, we invest a lot of money on research. So that keeps the doctors very updated, and also they remain in the world of medical fraternity very quite important. These are all things people are imbibing today, and that is why our healthcare is well known in the country, not only in the country, outside, in the neighboring country also. That is
Thank you, sir. Very well summarized. I'm going to now turn to the connecting link between clinical outcomes and the data and the digital side of things. And we are fortunate to have Chaitanya with us. Chaitanya, India, from a medtech perspective, the aspiration is to really be a global medtech hub under Make in India, Atmanirbhar Bharat. It's also about catering to 1.4 billion of our population and many who are not in India but outside in other countries. What is the role you think medtech, the policies and the current thrust areas in medtech, how is it kind of going in terms of ensuring access and quality to the right care, particularly the precision enabled care, and how do you see this unfold in the coming 5 to 10 years?
First of all, thank you, Siddhartha, and thank you for putting this panel together. I think we are deliberating some very important topics as we look at the needs for the 1.4 billion population that was highlighted from very different perspectives across the healthcare industry. I think from our perspective, first let's think about the lay of the land that we have. 1.4 billion population spread across the width and the breadth of India needs to get access to good quality care, which requires that not only is the care delivered close to their home in tier 2, tier 3 towns, which is where the large population exists. Secondly, it has to be delivered by clinicians and paraprofessionals who are not present in adequate numbers in our country today. There is some effort going on in order to be able to increase it, but to be able to do that. And third, it's an incredible statistic, but when you think about it from today's situation, while we are the pharmacy of the world, not only meeting the needs of the local population, but also exporting on medical technology specifically, we are still 75 to 80% dependent upon imports from other countries. And this, when as Dr. Mahajan said, every third doctor is an Indian, probably every second engineer is an Indian, and probably every sixth patient is an Indian patient. And so I think that's the lay of the land which we have to solve for. Now, over the past very many years, there has been substantial progress, whether it is from policy standpoint, whether it is from the standpoint of how the market and the industry has developed to be able to actually meet the needs. I think the very simple aspect is we have to make sure that we meet the local need by designing products which meet the requirement of the local population. We meet the local need through products that we manufacture here in India, that we are able to use. And we meet the local needs whereby we are able to deliver care in tier 2, tier 3 towns where the healthcare professionals may not be available in adequate numbers or in adequate level of skill or experiences. And if you think about it, I mean, Wipro Healthcare, we are a largest medical technology company based here in India. And we have been around for 32 years and we design products here, we manufacture products here, which actually are then utilized by the population here. I think the specific policy incentives which have been around from the government, whether it is the PLI scheme to incentivize the local manufacturing, whether it is the essential connections that are being established between companies and various academic institutions which are present here, or whether it is digital initiatives which allow us to be able to ensure that ICUs which are based here in big cities like Delhi are able to enable ICU care in small towns where patients might be present. And we have some pilots and actually scaled up pilots which are going on along those lines, coupled with the ability to automate or to use algorithms, as Dr. Mahajan mentioned, which ensures that care can be given at large scale in efficient fashion, which allows outcomes to improve, whether it is AI applications, and we are still the largest AI application producing companies. So I think those are the enabling frameworks which have helped, right? However, if we still have to make sure that we continue down this path quite substantially to meet the needs of the entire 1.4 billion, because even today we are not meeting the needs of the entire 1.4 billion population. And the policy incentives that I would say is we have to make sure, and both public and private facilities will continue to deliver care for health for patients in this world. 60% of the hospitals are essentially private, 80% of the doctors work in the private setting. So private and public has to work hand in hand in order to be able to deliver the care. We need to have incentives for the private providers to buy local products. We need to have incentives in such a fashion that we manufacturers or innovator companies are developing product which solely meet the need of the local population, whether it is in the form of delivering digital care, whether it is in the form of AI applications which actually enable Indian healthcare. And then the third thing, we have to learn a little bit from the success story of pharma industry. The way to deliver valuable clinical outcomes is to make sure that any industry gains scale. And that scale can only be achieved when it is able to service both local population as well as population outside the world. And that ensures, that scale ensures that the industry will be able to deliver value, which the clinicians will be able to pass it on to the patients. And I think those are the essential ways that I foresee that we can actually ensure that the 1.4 billion population acts as an asset for us to be able to build this industry. And I see that in the next 5-10 years, we would be not just the hospital for the world, not just the pharmacy for the world, but the medtech industry for the world as well. Our focus is India, but our vision is the world. And that's the way I would think about it.
So I think one of the pieces of discussion coming out here is, while we think a lot about 1.4 billion universal health coverage, how do we reach to so many people? In a way, having that sort of population is a huge asset. Whether you talk about doctors, nurses, local markets, which allows you to indigenize, localize, achieve scale. Taking that conversation, Sanjay, I was having a very interesting conversation with you. Another big asset there is India fast becoming a global hub for medical clinical research, for example, right? And the diversity of the population, the amalgamation of all sort of constituents, different factors coming in. There was a time almost 10 years back where ethical considerations were at its peak, and the entire clinical research market had taken a dip for some time. How has India overcome that, and how is it poised in the years ahead for both local drug innovations as well as global drug innovations? Your thoughts, please.
Well, thank you so much. And I think many of the esteemed panelists out here had mentioned about it, and Dr. Tyagi started the speech about keeping patient at the heart of every decision that we make, right? That's going to be very critical. So I think I'll touch the aspect of ethical considerations from 4 areas of it. And I think it has changed quite a bit than what it was probably 15 years back to where you see today from a clinical research perspective. The first aspect is the patient autonomy. So today, there is a very robust process in place from an informed consent perspective. I think at the end of the day, the right to what kind of healthcare treatment I need to go as a patient needs to reside with me. And I think that's something which has been placed very effectively right now with the new regulations that have come into place. The second area I would suggest is the healthcare that we are designing, is it in the best interest of the patient? And there are some great examples that are being rolled out. I'll tell you from my company's perspective in Parexel, we have our chief patient officer is actually a cancer survivor who went through this clinical research, and literally she was told to go home, take care of her needs. She's going to die in the next 2 months. And she was lucky enough to have participated in a clinical trial. And for the last 15 years, she's not only a cancer survivor, but she's a caregiver to a son who is 9 years old. Unfortunately, he's also going through a special rare disease situation. But what we are trying to do is we're listening to patient advocacy groups from inside out and understanding what the patient's needs are, what kind of best treatments, and how do you design the entire protocol to fit the patient's need from a best from the safety and the efficacy perspective is critical. The third area I would say, which is again something which is very important, is the confidentiality piece of it. And I think how do you continue to maintain the patient confidentiality information? Because when you're participating in a clinical trial, you need to make sure that it is completely unbiased and making sure that the data that you're collecting at the end of the day is maintained in the most confidential manner. The patient has a right to decide to which kind of authorities the access would be given from a data perspective as well. So I think putting all together with the new regulations that have come up in India, with the 2019 regulations, we're technically at par with the US FDA or the EMEA regulations. And I think the standard operating procedures that we see today at the investigator sites and the stakeholders that are going through all this, the whole need to have an ethics committee within the 50-kilometer radius for any investigator site conducting a trial also adds up to all of this together. So I think the ecosystem is absolutely there. I think it just needs to make sure that we continue to invest. And I think Chaitanya was also mentioning, continue to invest in new innovations, new molecules to come in. And I think it'll only, with 1.4 billion population, is the largest patient population. And then the most important part is by getting these trials, the access to medication will increase for the patients.
Thank you. Taking that journey forward, Dr. Santosh Shetty, I may request you to kindly, when you talk a lot about patient safety, patient experience, and patient empowerment, these are very, very important factors if you wanted to bring patients at the center of the healthcare system. How has the journey been as the world is fast changing, technologies are changing, clinical experiences are changing? What is happening to the patient experience and what is ahead of us in terms of what will improve it and take it to the next level?
Thank you, Siddhartha, and it's indeed a privilege to be a part of such an esteemed panel here today. So, two words I think which have come through repeatedly today are affordability and access. And while the government has been doing a lot in terms of the new aims, today we have 20 aims, a lot of which are in tier 2, going up to tier 3. We are talking of now more doctors, more nurses. I mean, we are about 1 lakh plus seats for undergraduate, and for postgraduate today, 50,000 odd seats. So the government in terms of access has done a fair bit. In terms of affordability, whether it is the Ayushman Bharat or the respective state schemes, I think the affordability element has also been slightly addressed, I would say, in terms of that. Now, coming from the private sector, I think the private sector is also contributing in its own way. If you look at infrastructure today, most of the leading players have moved to the tier 2 or tier 3 towns. I'd like to maybe give some examples of some of the work that we are doing, which is representative of what many other private sector players may also be doing. So if you talk of access, I mean, congenital heart disease and deafness in children, these were two of the most common but unaddressed problems affecting mainly lower socioeconomic strata. So we collaborated with the Maharashtra government and with the local district officers, wherein our teams are going every week to the interiors of Maharashtra, conducting camps and bringing these children to the hospital for surgery, because pediatric cardiac surgery is a very rare commodity. There are not too many people who do it. So through the RBSK scheme, which is the government scheme which is funding these children, including everything right up to the train fare for them to come. So these children actually have a access to come to a hospital like Kokilaben, which otherwise would not have been possible at all. So this kind of collaboration which is there between public and private, combined with the government through the various schemes contributing, I think has made a big difference as far as access and affordability both goes, because these children otherwise would never have an option of coming to Mumbai, forget even coming to Kokilaben hospital or getting a free surgery done. So this kind of collaboration, we've done close to 5,000 surgeries through this kind of mechanism. Similarly, we've done 300 cochlear implants through this mechanism. So that kind of collaboration, I think, will go a long way to improve both affordability and access. One other example that I'd like to give is in terms of cancer. What we saw is many patients come to large cities for cancer surgeries. But when it comes to radiation or chemo, these are spread over 3 to 4 months sometimes. So they cannot stay in big cities. We identified 18 districts in Maharashtra which did not have a LINAC facility. We went and set up daycare centers, just standalone daycare centers which only do radiation and chemo. And today, each of these centers, we've started 4 of them, each of these centers treats 70 to 80 patients every day. The chemo beds are full, and all of these are funded by the state scheme. So the state is actually contributing. Patients don't have to pay anything. And the technology that we are using, I mean, Chaitanya mentioned about technology. All the treatment plans are made at the Mumbai hospital and they are transferred to all the interiors. So the patients there have access to care which is comparable to what they would have got in Mumbai. They don't have to pay anything because they are all covered by the scheme. So just to summarize, I think collaboration, public and private, use of technology, I think is very, very critical to improve and make equitable healthcare. And third and most important, I would say innovative models, whether physical, digital, startups. I think all of these combined together can go a long way. Thank you.
Thank you. So I'm going to ask, thank you so much, Dr. Santosh. Kiran, you are not one of the most astute technocrats I know. As you were thinking about AVDM stack in its early days, how did you bring all these factors together into a transparent, secure, open platform that's going to scale for 1.4 billion people? Take us to the thinking and tell us what we can expect in the road ahead, please.
Sure. Thanks, Siddhartha, and good evening, everyone. Firstly, I'd like to thank, it's great to hear, some of the private sector players like Anand and you, sir, as early adopters on the AVDM ecosystem, right? So I think India has been one of the leading thinkers in what is now being called digital public infrastructure. Historically, does government have a role? You expect them to lay roads and other public infrastructure. But I think India has been one of the few countries which have said that, look, there is a role for government to bring and play a role in as an enabling technology that can make a difference to a sector. And I think all of us are benefiting from, say, UPI, which I'm sure everybody here in the room uses and is now a global phenomenon, right? So, and that happened largely because the government took this initiative to create a infrastructure called UPI, which all of us are now enjoying the benefits of. Very similarly, I think the question that started around the same time as we were looking at, we had the ID infrastructure in Aadhaar, we had a payment infrastructure. So sectorally, what is it that the government should do that can make a difference to healthcare was really the thinking that, started almost 2016 is when the original thinking started. It's taken quite some time for it to really get to where we are right now. And I think the constructs, and I think many cases, I think maybe as a government, we led with some of, I think, the wrong use cases probably from an early adoption perspective. I can understand the struggles that some of you might have been going through. We still see a largest adoption of many of the ABDMs in the public sector right now. And I think private sector adoption is still inching up very, very slowly. But I think stronger use cases are coming, and I think that's what I really want to talk about. So as far as hospitals are concerned, I would love all of the hospitals to take a closer look at what IRDA and NHA are doing with the Health Claims Exchange, the National Health Claims Exchange Initiative. I think this should be a big demand, especially for larger hospitals which are processing insurance claims. Today, for most insurance claims, for most hospitals, there is a significant issue in tracking and reconciliation of these claims. And what the Health Claims Exchange is promising is you will have one single digital way by which you can initiate a claim. So the moment you start that first claim initiation, you'll get an ID which you can then track all the way up to payment across a government PMJY scheme, CGHS scheme, or a private, ICICI Lombard scheme. So I think we are hoping under ABDM that will be something that will make a big difference. There's also been a big push on other use cases with UHI. So ONDC, as you guys have known, has created an open network concept. So for digital health services, so specifically things like teleconsultations, I think the government has come up with a way by which a doctor can actually be in control of their teleconsultation. Many doctors would hesitate to kind of promote, say, platform A or platform B and say, I am available on this to their patients. Whereas there's a lot of value for doctors, especially in their second or repeat consults, to use teleconsults. And so the government is actually, just like today, you don't think in UPI, when you make a payment as to what app the other person is using. I think UHI is coming out with completely, interoperable teleconsultation where a doctor can choose whatever app they want, they can control when they're available, and the patient can essentially use any other app and actually find the doctor and book it. So innovations of this sort, I think, with stronger use cases, I think will also help in ABDM's cause in many ways. But the core challenges, for UPI today handles billions of transactions, and we expect it to work, right? So I think on that, we do forget that the UPI journey also took time. The first spec was 2015. The first set of applications that people made, mostly from banks, more or less all failed, all on user experience and other challenges, technical challenges. So I think ABDM is also going through this journey. We have had the first set of early adopters, a lot of pain, both on the government side as well as I think on the partner side. Challenges on economic models, what is in it for various players, especially in terms of sharing health records and so on. So I think the good part is that what I see is that there is a proactive initiative within the government, right, within the National Health Authority, to understand, to talk to the stakeholders, to create this ecosystem, to understand this problem and see, okay, how can we actually make this move forward? So I'm personally highly optimistic. I'm optimistic that a lot of these ideas and visions that we have put together, especially I think India has been very forward thinking. I would also like to bring out the fact that India did pass the DPDP, the Digital Personal Data Protection Act. Healthcare is something that's going to come very much in the act. Anybody, any hospital that's using any piece of technology to maintain records is going to have to be covered. So ABDM, we have made sure is kind of aligned with that, and therefore, if you actually adopt it, it's going to be much easier to comply to that. So looking forward to how this scales out. But yes, as Dr. Mahajan said, this is not a one-year thing. It is going to be a journey. Probably it's going to take a few years for us to see the UPI moment in healthcare. Thank you.
I know that the bell has rung twice. I don't know if the organizers will allow one or two questions from the audience. They have been very patient. And I may request just one question. Just one. Hand up there. With your permission, just one question. Very quick.
Thank you. It has been rightly said that UPI momentum is required. So we need to understand what was the base behind the success of UPI momentum. It was benefit to the users. So if you can benefit the patients, the masses at large, they will provide their data and everything, and there are a lot of ways to provide secrecy and everything. So we should look at that, how they can be benefited, and we should deploy some kind of technology for that.
Thank you. Thank you. I think we are out of time. I would like to thank the audience first. This real interesting conversation, all the speakers. Together, the theme basically is healthcare is coming together. And when India solves that 1.4 billion people, the population, they have to deliver it with the constraints we have, the frugality at scale. It will be model for the rest of the world. And these are the architects who are sitting on the stage, along with a lot of other colleagues who are working hard at it. Thank you so much for your patience.
Thank you so very much, sir. Let's hear a round of applause.